There we go.
Yeah. So, yeah.
Yeah, thank you very much for having us. So I'll introduce ourselves first. So I'm Lucy. I'm living with type 1 diabetes myself. I also work at Diabetes UK, and then I also play football as well. So we are both from the diabetes football community too, which is a smaller charity where people get together to sort of talk about diabetes and football. We also play sometimes as well, which is really nice. And then there's also a men's side of the diabetes football community as well, and a kids side of the diabetes football community. And we'll talk a little bit about that later on. Louise, do you want to introduce yourself?
Yep, so I'm Louise. I also have type 1 diabetes. Played football since about the age of 9. And then was diagnosed around 11. So a few years without diabetes, and then most of my life now playing football with diabetes. Yeah, and just joined the diabetes football community when I came across it, because it was something that I definitely wish I came across when I was a bit younger, and I think now we're sort of setting it up that that's available for um, both kids and adults going through the same sort of journey. So yeah, that's good. Yeah, and then I'll pass over to Lucy with her slides.
Yes, so I think just for tonight, so we're going to go through a few slides around sort of just generic diabetes awareness. So what diabetes is, because I'm aware we're experts because we've had it for over 10 years each. So just to sort of explain what it is, how it affects us, and then we'll sort of relate to diabetes and football towards the end, and then we'll open up for any questions that you might have as well. So I'll just share my screen. And feel free if you want to ask questions as we go. It's very informal, so feel free. And there's no stupid questions, by the way, because it's a very confusing condition. So that's just what I've just basically explained. So, quick quiz, and you can put these in the chat if you don't want to sort of come off mic and answer. Can anyone name how many types of diabetes there are? Or any types?
Isn't it just 2 types?
So
Is it?
So there's 2 main types. There is lots of different types, but the 2 main types are type 1 and type 2, and I'll touch a little bit on some of the other types shortly. So what percentage of the diabetes community has type 2?
It's type 2, is that where they take the pills, not the shots, is that right?
Yes, so for type 2 it can be either medication, which is usually tablet form. Some people living with type 2 diabetes do have insulin too, and then some people just manage it through lifestyle, so diet and activity as well. It all depends on just what sort of level they're at of type 2, like how long they've been diagnosed and things like that. But the highest percentage is type 2, so it's now split 90% of people living with type 2 and 10% living with type 1. I think it's actually 8% living with type 1 and 2% living with the other types of diabetes. I think there's a slide on that actually. So some types of diabetes are milder than others. Is that true or false?
True.
So it's actually false. So what I always say is how I explain this is actually I'll give like a little personal experience. So I'm type 1 and my mum's type 2. And I think everyone's diabetes is just different. So like type 1, obviously, yeah, obviously got insulin and things like that. But like I said earlier, type 2, you can also have insulin. So there's no sort of milder, stronger version of it. It's just everyone's quite different, and people deal with diabetes in different ways as well. So, someone might not be someone with type 1 who everyone seems to think that type 1's worse, but someone with type 1 could be managing really well, and then someone with type 2 might not be managing at all. So it just really depends on who the person is and what type of diabetes they have as well. So type 1 diabetes is always treated with insulin, true or false?
Probably would have said true, but maybe not.
It is true, yeah. So type 1 diabetes is where your pancreas doesn't work at all, and your pancreas is the organ that produces the hormone insulin. So yeah, it doesn't produce any insulin at all. So that's why people with type 1 either have to inject insulin, or they can have new diabetes tech like pumps and things like that. Finally, thirst is a symptom of diabetes. True or false?
True.
True.
That is true. It's one of the 4 T's. So it's thirst, tired, toilet, and thinner. They're the 4 T's that you have to remember. And I will go through them again. But yes, thank you for joining in with the quick quiz. So what is diabetes? I've got a little video on the next slide. I don't know whether it's going to play, but we'll try it anyway. If someone could come off cam in a minute and just put the thumb up, that'd be great. I think, Louise, if you do it, because I think I can see you.
Yeah.
What is diabetes? Diabetes is a serious condition where your blood sugar levels, also known as blood glucose levels, are too high. It's diagnosed from a blood test. There are 2 main types, type 1 and type 2, which is the most common, and lots of other types like gestational diabetes, type 3C and MODY. The causes and symptoms depend on the type of diabetes you have. Diabetes happens because of a problem with a hormone called insulin. When you eat or drink, any carbohydrates you've had are turned into glucose, a type of sugar. Insulin acts like a key to unlock the cells to let the sugar in, to give you energy. If you have diabetes, this can't happen, so sugar builds up in the blood. High blood sugars over time can cause problems in almost every part of your body, from your brain to your feet. So treatment is about trying to keep blood sugars within a target range. Being as active as possible, eating healthily, and going for regular health checks will help you do this. Some people will also need to take insulin or other medication and check their blood sugars regularly. Lots of things can affect blood sugars, so it can be tricky to balance. But it's possible to lead a full life. It's about being in tune with your body and learning what works for you. You can get more support from your medical team and us here at Diabetes UK.
Let me just stop sharing because I don't know how to actually click off that PowerPoint now. Perfect. So that was just a little bit to explain it, but I'll go over it a little bit more as well. Oh, there we go. So what is diabetes? So it's a serious condition where the amount of glucose in the blood is too high. So basically, we've all got sugar going around in our blood, and ours just doesn't sort of break down. It just stays in the blood and it's carried around. This can happen when the body doesn't make enough insulin, and that's what type 2 diabetes is. Some people may have, may be able to produce a little bit of insulin, but not enough, and that's why they don't always need insulin. They might just need medication or lifestyle changes. Or the insulin it makes isn't effective either, or if it doesn't produce any at all. So this is how we sort of try to explain it. So type 1 diabetes, there's no key. So if you act like the cell is the padlock and then the insulin is the key, the insulin's trying to get in the cells and it can't access it. And then type 2 diabetes, some of them open, but some of them don't. So it's just a little bit of an analogy to sort of work out which is which. Woohoo! So I did get it right before. So it's 90% of people live with type 2, 8% live with type 1, and then 2% live with the rarer types as well. So some of the types of diabetes I don't even know about either. But the other probably bigger one is gestational diabetes, and that's for women who are pregnant and develop diabetes within pregnancy, but then it can go. And then it does put you at risk for later on in life to get type 2. I think there is a slide on that, so I'll go through it. So some characteristics of diabetes, so some risk factors. So risk factors for type 1 diabetes, genetics play a small part. So it can be in the family, but it's not actually proven that it's genetic. So There's obviously studies and stuff like that going on. For type 2 diabetes, there's lots of different risk factors. So age, family history, ethnicity, living with overweight or obesity, high blood pressure. Like I explained earlier, so no insulin made for type 1 diabetes, and then not enough insulin, or the insulin doesn't really work properly and effectively for type 2 diabetes. The age, the most common age is children and young people for type 1 diabetes. However, I do know quite a few people who have sort of got diabetes later on in life as well. And then type 2 diabetes is more common above 40, the age of 40, earlier in people of Black African and Afro-Caribbean and South Asian as well. So they're more at risk to get it from like age 25 to get type 2 diabetes. And they don't particularly know the reason for that. It just tends to be sort of sometimes their diet and things like that, and their sort of culture that they're around as well. The onset for type 1 diabetes, so how quickly this comes on, it's really fast. So I think I really deteriorated for like 3 weeks, and then obviously found out I had type 1 diabetes. I'll go into that a little bit more later and tell you my diagnosis story. And then type 2 diabetes, it can be quite slow. You can have type 2 diabetes up to 10 years and still not know. We find that a lot of people go into sort of hospital with type 2 diabetes, but actually they're going in with a complication. So it might be that, someone's got a foot ulcer, or a pain in the foot, something like that, and they go into hospital and actually they get diagnosed with type 2 diabetes because of that complication. Or they might have some struggles with the eyes or the kidneys and things like that. So treatment, type 1 diabetes, insulin, so either by pump or injections. So I was on injections for 10 years. I've just more recently gone on to a hybrid closed loop, which is an artificial pancreas. So basically it's a little pump. In fact, it's on my arm. I don't know if you can see it. That has insulin in it. I change it every 3 days. I syringe insulin into it and then stick it on my arm, and it sort of attaches to my arm and it pumps through, which is amazing, because doing injections sort of like 5 to 10 times a day was really taking its toll after 10 years. So the technology is really, really good now. Diet and physical activity still does really work for type 1 diabetes. If I do exercise and I eat well, it makes me feel good and keeps my levels in check as well. So it does sort of still play a part of it. Diet and physical activity for people living with type 2, so you can get something called pre-diabetes if you manage to change some of your lifestyle habits, and you manage your diet and your physical activity, then you tend to stay at pre-diabetes, and you don't really go on to develop type 2 diabetes. People with type 2 diabetes may be on medication such as like metformin, and some people are on injections of insulin and things like that as well. The genetic link, so you're a slightly higher risk of developing type 1 diabetes if your mother, father or sibling has it. So that's what I meant about genetics earlier. So some people, like my nana, had it, but actually it's not really, it might not be linked. I mean, I believe it is linked, but it's not proven. So it's just sort of looking into that. Type 2 diabetes, so people with diabetes in the family are 2 to 6 times more than likely to have diabetes than people without diabetes in the family. So it is sort of there, like a family history of diabetes as well. So what causes type 1 diabetes? Again, the exact cause is unknown. It's an autoimmune condition, so family history can obviously increase your risk, and it could be the result of environmental factors such as a viral or other infection. So I think I actually had a cold at the time, and then that sort of triggered it. I had a viral infection, so that obviously took its toll on my body. But they do think that sort of like some of the diagnoses have gone up since COVID and things. So COVID has triggered some diagnosis, and then also sometimes trauma can cause diagnoses as well. So there's lots of different ways that it's caused. So the risk factors, so why type 2 diabetes is caused is, again, age. So you automatically go higher risk when you become above 40. If you've got someone in your family, you become more at risk. Ethnicity, like I've touched on. If you've got higher blood pressure, your weight, and then waist circumference as well. And you can actually check it online. We have a Know Your Risk tool online, so that's on the Diabetes UK website if you want to check that out. So other risk factors, so having a heart attack or a stroke puts you at risk of type 2. Gestational, so having gestational diabetes when you're pregnant puts you at higher risk of developing type 2. Women with polycystic ovaries or who gave birth to a baby over 10 pounds. Smoking, alcohol consumption, disturbed sleep, depression and mental illness as well. So the 40s, like I touched on earlier, so going to the toilet more often, extreme thirst, tiredness, and weight loss. Also genital itching, so such as thrush, things like that. Slow healing of cuts and wounds, and blurred vision as well. So this is something that you might hear when people talk about diabetes when they're diagnosed. So a lot of younger people find out they've got type 1 diabetes because they go into something called DKA, which is diabetic ketoacidosis. It's a mouthful. I'm quite proud of myself for getting that out, to be honest. It's a serious condition. It mostly affects people with type 1 diabetes, and it happens when there's a severe lack of insulin in the body. It means that the body can't use sugar for energy anymore, so it starts to use the fat. And then when that happens, chemicals called ketones are released, and they're quite fatal. If left unchecked, ketones can build up and make your blood become acidic, and then that's sort of why the name's acidosis. If someone has DKA, they should seek immediate medical advice. So what it can cause and how your sort of symptoms may come across, it might be that you're feeling sleepy and tired, thirsty, and sweet smelling breath. So that's what mine smelled like. So it's like pear drop sweets. So it becomes quite apparent on your breath. Stomach pain, feeling sick, needing to go to the toilet more often, which is a massive symptom of having high ketones, high blood sugar levels, confusion, passing out as well. So diabetes and ethnicity. So as you can see, the cases per thousand of population is sort of backs up what I was saying about ethnicity. So you are at higher risk. So people from Black, African Caribbean, South Asian and Chinese backgrounds and other minority groups are 2 to 4 times more likely to develop type 2 diabetes at a younger age and a lower BMI. And this is what we sort of talk about like sort of diabetes stigma and things like this. So it might be that you look at someone and go, oh gosh, you don't look like you'd have type 2 diabetes, but someone with a lower BMI, but maybe from a South Asian background, they may be only 25 and they have type 2 diabetes, and that's because that's just the risk factors of type 2 diabetes. So sometimes it's not that, you know, a lot of people think type 2 diabetes is someone overweight and, you know, has a bad diet, doesn't exercise, but actually it's not the case. There's lots of different risk factors for type 2. So living with diabetes, so eating well, obviously, I mean, like I said, type 1 diabetes, it can be helpful with your diet. So for me, I can eat whatever I want. I've just got to count the carbohydrates in my foods and have insulin for that. Now, there is things that make me feel better than others. So, for example, I wouldn't just sit here and have a bottle of Lucozade because that wouldn't be no good for me. And personally, I think it's too much faff because I'd have to work out how many carbohydrates in a Lucozade. However, I will need Lucozade if my blood sugars drop too low. But that's where I sort of look at my diet. If I think, like, I only really ever have diet drinks. I don't drink full fat drinks. And then obviously when it comes to things, I don't tend to sort of have loads of sweets all the time. But that's just out of choice. It doesn't mean we can't. I can literally eat whatever I want as long as I inject for it. So when it comes to type 2 diabetes, obviously there's some things that can be changed. So eating well, so making sure you've got a balanced diet. So fruit and vegetables, whole grains, beans, pulses, fish, nuts, unsweetened dairy, unsaturated fats, and then trying to reduce your red and processed meats. Foods lower in fibre, such as white bread and white rice, sugary drinks, sugary foods, and saturated fats, such as butter, lard, and ghee. So it's just, you know, trying to reduce those things and making them small little changes in your diet can help you to reduce your risk of type 2 diabetes. So moving more, again, this is more for type 2 diabetes as well. So doing at least 150 minutes of moderate intensity activity a week, 75 minutes of vigorous intensity a week, or a combination of both. And then, yeah, so just making sure you're getting out there and moving more. And, you know, we talk about exercise. It doesn't mean that you have to go and do 30 minutes on a treadmill. It could be that you just go for a walk, or, you know, you get dropped off at work a little bit further back, so you have to walk to work a little bit and things like that. Doing some more gardening over a weekend. You know, it doesn't need to be a gym class, or, you know, doing a big marathon or something like that. Hypos and hypers. So this is an important one for football. So the full name for hypo is hypoglycemia, and this is when the blood sugar goes too low. So I always think of it as hypo low, so like low po type thing. It rhymes. So this can happen quickly. So hypo symptoms can be tiredness, sweating, headache, trembling, shaking, blurred sight, feeling tearful, going pale, lack of concentration, palpitations and a fast pulse, and lips feeling tingly. So for me, when I'm playing football and my bloods go low, I just feel a lot like quite light, and, you know, I can feel it a little bit shaky. I'm sweating more than I would usually. And it's just not a good feeling. Some people may come across that they're actually drunk as well. So that's always something to remember, you know, if you see someone behaving like in a drunk way, but you're not too sure if they've had a drink or they shouldn't be that drunk at the time. It could be that they have type 1 diabetes, so maybe just check for any medical conditions. And then there's the other way around, so you could go too high as well. So the full name for that is hyperglycemia, and that's when it becomes too high. So that's sort of when the symptoms of diabetes become more heightened. So passing more urine than normal, especially at night, being very thirsty, tiredness, being lethargic, thrush or other reoccurring bladder and skin infections, headaches, blurred vision, weight loss and feeling sick as well. Being hyper is not nice either. So your blood sugar should be between 4 and 7. That's what a normal person's blood sugar would be. Now that's a complete balancing act for the likes of me and Louise, so we have to sort of, you know, balance it out. So my blood's maybe, you know, 2.1 sometimes. It could be that they're 14.7, you know, and that's totally out of range, and that's when you become too high or too low, and that's when you have to treat that. So when it gets too high, you have insulin or treat it like you need to. And then when the blood sugar's too low, that's when you need sugar. So you have something such as Lucozade. It's something that needs to be like fast acting sugar. So I have like glucose shots. I don't know, maybe you're seeing like glucose tablets, like energy tablets, Lucozade tablets, and things like that. They're fast acting, so you don't want to be giving someone. I think everyone always refers to a Mars bar when someone's blood sugars are low, but actually chocolate is quite a fatty sugar, so it takes quite a lot of time to sort of get into the bloodstream. So we do recommend more of a fast acting sugary drink, something that can absorb quite fast. Complications. So people living with both types of diabetes are at risk of developing complications throughout their life. So retinopathy, that's something around your eyes. So we have to go and get eye screening every year. So we have some drops put in our eyes, pictures of our eyes taken at the back, and that's just to make sure there's no bleeding on the eyes. And what that usually causes is blotches. You can actually see online sort of what someone with retinopathy can see. It's like black blotches within the eyes, and it can become that you're visually impaired if you're not careful. Cardiovascular disease, so heart attack and strokes, you're more at risk of those. Nephropathy, that's quite a hard word to say. So that's kidney disease. Neuropathy is nerve disease, foot problems, sexual problems in men and women, and gum disease as well. So there's lots of different complications that can happen. However, you know, if diabetes is managed well enough, then it shouldn't become a problem. And that's why you sort of have the tech that we're getting now, sort of to reduce these complications as well. So why is awareness important? So early diagnosis can be sort of like, it can save a life. So, you know, when I was talking about DKA before, so that diabetes, diabetic ketoacidosis, that is fatal. So, you know, if the symptoms aren't recognised, sometimes it can be fatal, and sometimes people aren't diagnosed. Unfortunately, it's too late. So knowing those symptoms are really important to be able to sort of point that out to someone. You know, if you may have a child in one of your training sessions who's been to the toilet 5 times, they've drank, 4 bottles of water in an hour session. It could be that you point out to the mum, and these are quite symptoms of type 1 diabetes. It could be that you should go and get checked, and that could be really helpful, and it could save a life. So it's raising awareness so people know what the symptoms are, and also, again, like it says there, reducing that risk of developing complications in the future as well. And it's vital that everyone across the UK knows their risk of developing type 2 diabetes. Again, like I said earlier, we've got a free online tool if anyone would like to use that. And diabetes is a misunderstood condition. Again, stigma is massive. The amount of times I've been asked, can you eat that? And sometimes, people are just uneducated and they don't know. That's why these sessions are so important. But the amount of times it's, you don't look like you're diabetic, and can you eat that? And it's like, did you eat too many sweets when you were younger? Is that how you got type 1 diabetes? And it's fine some days. I'm quite happy to educate people, but then other days I'm just like, ugh, I don't want to deal with that today. So, the more education around diabetes is really important for those living with it. Which leads me nicely onto diabetes stigma. So it's the negative attitudes, beliefs, or behaviours towards someone because of the diabetes. And again, a massive part of that is coming from the media. The amount of times people have put on about just diabetes in general, and it's a picture of someone overweight in a newspaper. There's so much more to diabetes than that, and that's why people don't know the difference between the two types. And unless you've got someone close to you living with either of the types of diabetes, then you don't really know what it is. And I would be the same. I didn't know what diabetes was before I got it either. So it can have a long-term and serious effects on people living with diabetes and their outcomes. Like I said, it becomes a little bit draining when people are asking these questions and things like that. I love educating people about it, and talking about it and raising awareness. But sometimes it can take its toll, and you're sick of answering the same questions, or someone saying, can you eat that? It's not very nice when actually, yeah, I can eat what I want, and that's just the way it is. So understanding more about diabetes and not making assumptions helps stamp out stigma. So it could be, asking it in a different way. It might be that you are just intrigued if someone can eat that, but can you ask it in a way like, oh, how does that affect your diabetes? Will that make you feel rubbish later, or are you able to just treat diabetes, and can you have that piece of cake? Because I love a piece of cake. So yeah, that's a massive part. So diabetes and football. So I'm going to stop sharing now, and I'm going to let Louise speak about her experiences now, because I need to have a little drink, a little setback. But I hope you've learned a little bit more about generic diabetes, and then we can go on to now a little bit about football and diabetes, and then you can ask any questions, if that sounds all right.
So my blood sugars have actually just gone low, so I had to run down and get a orange juice. So classic timing.
Do you want me to go first, Louise? I don't mind.
Yeah. Do you want to go first?
Yeah, that's fine. So obviously I was diagnosed with type 1 diabetes when I was 13, so 12 years ago now. I'm 25, so it's just like second nature to me now, to be honest. I was actually just started playing football that year. I was in year 8, and I was on holiday. I was really thirsty all the time. I'd lost loads of weight, but I was always eating. So my parents were actually worried that I had an eating disorder. So they sent my sister in the toilet, because we were actually on holiday on a cruise, and they were checking that I wasn't being sick after I'd eaten, because I was losing so much weight. Obviously, I was in a bikini and things like that, and I had lost a lot of weight, drinking lots. We actually did this big walk one of the days, and my dad was like, oh, it's not many kids get taken on a 5-star cruise at Easter, cheer up and all this. And then 2 days later I was admitted to hospital with type 1 diabetes. So when we got home from holiday, we actually went to McDonald's, nothing in the house. So we went there, and I didn't actually eat my meal. I just wanted another drink, and my mum was aware of the symptoms already, because my nana had type 1 diabetes, her mum. So she was aware of it, and she had type 2 diabetes as well. So she had a blood machine at home, and she said, oh, I'm going to do your bloods when you get home. I was like, no, you're not. So I was like playing out on the front like for the longest time ever. And then she called me in and was like, come on, we need to do it. And I was like, no, no. Anyway, she did it and they were just coming up as high, like they weren't even reading as a number. Um, so then my uncle is a GP, so my dad rang him. He came down and sort of did it with a better meter, like a better blood glucose meter. Again, it was still saying high. So they put me in the back of the car and took me to A&E and fast tracked me. And then I was literally taken into intensive care straight away to get my blood sugars back down because they were 37.5 and they should be between 4 and 7. So obviously, and they did say like if you'd have left it any longer, then you probably wouldn't have made it through the night before going into DKA, which is diabetic ketoacidosis. So yeah, it was quite like obviously shocking at the time, and you know it is a life changing because I think the first thing they sort of talk to you about is that you know that's it now for life until there's a cure. You know that's it. This is what you're gonna have to do. You're gonna have to inject. And you always get told the same thing, like, oh, there'll be a cure in 5 years, don't worry. I'm here 12 years later and there's no cure. So there's lots of work going into it and it's amazing to see that. But yeah, but the tech that we've got now. So I used to be finger pricking, so testing my blood sugars through finger pricking, you know, 5 to 10 times a day, then also injecting like 10 times a day because you do have to inject for everything you eat pretty much. And I eat a lot, so I was having lots of injections. But I went onto the pump last year, so that's been really, really helpful for me, and it just helps me sort of level my blood sugars out like a lot more. I don't have many hypos in the middle of the night anymore. I don't have many hypos at all, to be honest, which is really good. And it just manages. So that's sort of what I was talking about, like balancing your blood sugars. It just helps that and it sort of keeps it quite steady, which is really good. Obviously, it's not perfect, but it has, you know, made management a lot easier. And then football, when it comes to football, the pumps really help that. You know, um, I used to obviously take my insulin injections to football and stuff because I actually spike. So my bloods, well, they don't now, I'm on the pump. But what used to happen was I'd play football, especially in a game scenario, not so much training. But when I was in a game scenario, I think it was because of the adrenaline and sort of nerves, maybe, depending what sort of game it was. My blood sugars would shoot up for some reason because you do tend to think that exercise causes it to drop, but actually put the adrenaline in there and sort of your feelings as well, because there's so many different factors that affect blood sugars. It made me spike, but then I knew if I did treat that with insulin, I would come crashing down straight after the match had finished. So it's sort of like getting to know that and getting to know your own routine. So if my blood sugars were really high, sort of half time, I would maybe do a little correction of insulin, but not too much, because obviously come full time, I know that they were going to drop straight after, and then I'd probably have a little bit of food with that as well. Um, so how I sort of my match day would look is obviously breakfast in the morning is quite important, and I would just probably have the normal sort of rate of insulin that I'd normally have, just due to me spiking usually, and then obviously I'd check my blood sugars before going out for the warm up. When I come in from the warm up, I take my meter out at half time. Um, so I'm constantly checking. So actually my meter is my phone. So I am able to have that. But even stuff like that. So when it comes to stigma, I think, you know, like having your phone on the sideline and things like that, and people not knowing why she got a phone. I think once, so I put it in the first aid bag, and so if I go down, the first aid or physio always comes on and they'll give me my phone straight away. And I think a ref once said like, oh, why are you checking your emails? And you know, it's stuff like that, like it can be quite embarrassing. And I was like, I'm not. But at the time, my blood sugars were obviously high, and that can make you feel a little bit more like angry. And so I was like, I'm not. And you know, it makes a reaction and things like that. So it's just being aware. And even if he was joking or whatever, it's just not the time to really sort of have that joke. And the other thing in football as well, with like sort of like maybe feeling embarrassed sometimes, like pre-season when you know you're getting beasted, you're having to do like all your fitness and things like that going hypo, and people think, oh, you just use it as an excuse and things like that, and it does become embarrassing because, you know, I'd much rather be getting beasted than having a hypo. Don't get me wrong, it can be a perk sometimes when you have to sit out. But yeah, some things like that, it is hard. And then yeah, sorry. So back to the match day. So after so checking at half time as well. Um, you know, I have had a few times where I've not been able to start a game when I'm supposed to be starting because my bloods are a little bit too low. So I just say sorry. I would rather get them up a little bit higher before going on. And you know, my coaches and managers are really understanding. I think that's a massive part of it as well. I mean, you guys even coming on today is really helpful for you to get that understanding. But for me, I think your coaches and managers knowing is so makes it so much more comfortable. You know, they're always, if I know now, I just go and sit out if I need to, and they'll just go, you all right, Luce? And I'll be like, yeah, and that's it. They just check in on me. It's not like, why are you sat over there, what are you doing? There's not a big hoo-ha, and I think that's always been my worry about it, because I'm not like a person who likes a fuss. So like having that relationship is really important. And again, it's the same with like kids with PE and things like that, teachers knowing. And but yeah, I think that's everything. So Louise, are you happy to continue? Are you back in the room? I can't hear you now. Oh,
2.9, yeah.
you were a little bit quiet. Maybe come a little bit closer.
Yeah, maybe it's
There you go.
Okay, yeah, so I'll just talk through my diagnosis and then sort of like my experiences in football as well. So I think I was 11, it's around that age. And I had been drinking like non-stop water when I would have to be forced to have a glass of water before I go to school. Like my mum would make me, because I just never really drunk anything generally. And then one summer I was constantly like down in pints and pints of water. And my mum kind of knew the symptoms because my auntie was diabetic, but again, it was something, even though she was diabetic, it wasn't something that we were all really aware of, which in hindsight is actually quite bad. Like we hadn't really understood the condition that she was living with. But yeah, so this one summer I was just constantly drinking. And I then had it was actually a school national cup game, and they provided it was like sponsored by Coca-Cola. So we had like Powerade on tap, pretty much, Coke, Diet Coke, everything like that. But at that point, obviously, I didn't realize that I was diabetic. So for the game, I was drinking Powerades, which obviously is probably the worst thing I could have been doing in that situation. And my dad was watching in the stands, and he was just like, "Oh, you like without being horrible, he's like, you just really weren't playing like you normally would. Like you looked really sluggish and didn't look like you were concentrating in the game and things like that." So obviously I was annoyed at that. But then like a couple of days later, my mum was sort of like, okay, enough's enough. Like you've literally been drinking so much more than normal. We'll buy a testing kit. Oh no, sorry. We went to the doctors, and the doctor was literally not phased. He sort of said, "Oh, we'll send you for a blood test in 2 weeks, and just sort of see what that shows." But my mum was sort of having none of it, and we went to the chemist and brought a testing kit. And similar to Lucy, my bloods were like 42, which obviously, like she said, they're supposed to be between 4 and 7, so 42 is like ridiculous. But then my mum's like, okay, so what have you had at school? And I say, oh, I did have a packet of Skittles, and I had like a big lunch and all this sort of stuff, which, because we didn't understand how it all works, we were like, oh, maybe that's why my blood sugar is so high. But obviously, even if someone has like eats sweets all day, their blood sugar still would never go as high as that if you're a non-diabetic, so we weren't really aware of that. So we actually were like, okay, well, we'll wait until the morning, like not have anything to eat, see how my bloods are in the morning after no carbs or no sugar. And then when I woke up, they were still in the late 30s. So at that point, then we went to A&E. Luckily, I didn't feel ill. I probably think we caught it just before I started to sort of deteriorate, because I think a lot of the stories that I've heard from people that I've met, they were really ill when they get diagnosed. So I'm grateful that I weren't in that situation. So then I was kept in hospital for 4 days, and when they gave me the diagnosis, I cried and just said, like, will I be able to play football again? Because that was literally all I cared about at that age. So I was playing like football for both Saturdays, Sundays, training twice a week, all of that. So I was like, oh, like that's all I care about right now. I'll inject, I'll do anything as long as I can still play football. So they were like, yeah, you can. And then they even let me out for like a couple of hours on the Saturday to go and play a game, which was like such a relief that I could still carry on. So I think from then, similar to Lucy, I was on injection. So yeah, so generally we'd have to do an injection, like a standard one in the morning. Then if you say like your breakfast, lunch, dinner, so you're doing at least 3, and then another one at night. So your standard day would be like at least 5 injections. And at each point then you're testing your blood sugars. And then obviously being a kid, I'm not just getting to eat breakfast, lunch, dinner. So it'd be like snacks, all this sort of stuff. And like you could try and control it, but it's also that hard part of like you want to just be like everyone else as well. So things like if you were going out for people's birthdays and there'd be cake and stuff like that. So you just always wanted to be able to not be like the odd one out. I think within sport, I wouldn't say I hid it, but I didn't really speak about it much with people on my team or my coaches. And I think looking back, probably my coaches didn't understand it well enough to be able to support me properly within football. And obviously, I think that's probably a bit of both ways. I should have been a bit more, and probably my parents as well, maybe trying to educate them a bit more, and then they should probably have wanted to understand it a little bit more, because till the age of 16, I was playing at a centre of excellence. So I was trying to play at quite a high level. And obviously it would have an impact on my performance. But obviously sometimes I'd know that it was down to my diabetes, but I didn't really want to blame it on my diabetes to sort of be like an excuse. So I think maybe if there was a bit more of understanding of how it can impact me during a match, and even just around the game day sort of thing, I think it would have been a much better process. Because like things like just I find, I don't know about you, Lucy, but if my blood sugars are really high, like concentration definitely goes a bit. So if you, like Lucy was saying, I was the same, my bloods would spike during a game. So I'd find myself, I would be doing loads of insulin. This is when I was a bit younger and didn't look after it as well. I would do loads of insulin before a game to try and keep my blood sugars level throughout the game and try and be at the top of my game. And then after my game, my blood sugars would crash down and I'd have to like basically then just like binge with sugar to come back up. So it was like not very well managed at that point. Obviously, as I've got a bit older and understand it more, and I think just general education around diabetes and sport has changed. I think when I was younger, I was just basically told if you run, your blood sugars is going to go down. Carry sugar, do less insulin beforehand. But actually, I was seeing the complete opposite of what the doctors were telling me. I was like playing football, because obviously you've got sprinting and like anaerobic within the same exercise period. your body like reacts differently to both of those. So generally, if I was to go, is it aerobic and you're just sort of going for like a casual steady run, then your blood sugars potentially, they'll start to come down eventually. But with anything more intense like sprints, even like weightlifting and stuff like that, your blood sugar will actually increase. So during a game, when you've got different things going on, you're sprinting 1 minute, you're just jogging along another, your blood sugar is just sort of all over the place. Whereas kind of the doctors that we were seeing when we were younger weren't experiencing that firsthand, so it was quite hard for them to help you, which is why being part of the diabetes football community is like great, because we can actually speak about these experiences and we can say, oh, this happens to me during a game, and then someone like, oh, me too, this is what I've tried, you can try this. So that's been really helpful. I feel like I'm just waffling a bit now. I don't know where my point was. But yeah, so I've also recently changed to a insulin pump. So mine's slightly different to Lucy's. So I can detach mine. So this is my pump. So within here, I have insulin that I change. This is now, I change it every 7 days. So I was on an every 3 days, which actually comes around really quickly when you think, I've only just changed that. And then I have here, so this is my blood sugar right now. It's 3.6. I'm still a bit low, which is probably why I'm waffling. But yeah, so I can detach this, but this also has pros and cons, because this morning I had to drive back to where I trained for football last night, because I took it off for training, left it in the hall. Didn't realise, don't ask me how I didn't realise till I got home, which is an hour's drive away. Get home, realise, oh, I'm screwed, basically. I've got to go back and get this, but obviously the school shuts, everything like that. Kind of had a little bit of a panic stations. Luckily, I had backup injections in my fridge, so I had to go back to old school for a night, and then make a long journey this morning before work to go and collect it. So it's great technology, but I think I'm the problem, not the technology. But yeah, I think throughout football now, you probably see people with various different versions of the pump. So like Lucy has the Omnipod, which is on her arm, or can be on like your back or your stomach, I think, as well. So that's attached to you sort of all the time, but you change it every couple of days. And then I've got obviously this one that detaches, but there are a few others, I think, loose, aren't there?
Yeah, I think obviously tech's coming on like leaps and bounds. Like you probably see, so not only do I have that, but I also have another sensor. You've probably seen like the little discs that people wear. Yeah, so there's that one. So that's like the Freestyle Libre. I wear Dexcom. You probably see that on the telly as well. So there's just like loads of different ranges of tech out there now. But everyone's different and everyone suits different ones. So a lot of people find that these ones fall off their arm, whereas mine don't. People want tubed pumps. Some people don't want tube pumps. So they're all just very different, to be honest. And it's a massive thing to know about, because there's lots of different ways. And like I say, everyone with diabetes is completely different. So everyone's their own sort of individual with it. But yeah, I think that's everything, unless you've got anything to add, Louise.
I guess I was just going to say, because I didn't have my pump last night, I put this sensor on, which is a Freestyle sensor, and basically I think this is probably one of the most common sensors that people use at the moment, which is when you'll probably see people use their phone more for that as well. So the way that works is, so on my phone I have an app, and then it sort of says ready to scan. So you might see people like holding their phones up to their arms and think, what are they doing? But basically you just hold it up and then it will tell you what your blood sugar is. So this actually tells me I'm 5.8, but my pump is telling me I'm 3.6. So that's another complication. But I think basically measure slightly different fluids, which is why you'll have a slightly different number. But yeah, I think a lot of kids will have their sensors connected to their phones.
Yeah.
So obviously that's something to be aware of, like for training, and like if you think someone's just like texting instead of actually listening to you, but a lot of the time it could just be that.
Yeah, and they have to be like quite close to you as well, otherwise they're not in range. So like some of them only have like, because like mine's Bluetooth on my phone, so mine's just like, I don't know if you can see it, it's not going to show, but anyway, I'm gonna write this down a little bit. Yeah, so mine's like that, so it's like more Bluetoothed all the time. So again, it's got to be in range somewhere for it to work. But yes, does anyone have any questions for us? It's okay if you don't, but feel free to ask away if you have got anything.
I have a question for you both. I just want to say thank you so much for being so open and honest and sharing sort of your personal experiences with players and people with diabetes. We know we've got a few coaches on the call tonight. From your own experiences, what do you think coaches and match officials? I know you mentioned an example yourself, Lucy. What do you think coaches and match officials can do to create sort of the right environment to best support and help players who do have diabetes?
I think for me, it's, having a conversation with that individual. Someone may want the coach to know everything about diabetes, and another person might just say, do you know what, I know how to manage it, I'm quite laid back, but if I take a moment out, then let me just take that moment and don't fuss. And I think everyone's a little bit different in that matter. And again, it depends on sort of age as well. If it's a child, the parent might, want a little bit of training for the coach, which, the parent is probably used to doing with the school and things like that. So I think being open about it and just sort of seeing, if someone does approach you and says, oh, my child, or I have type 1 diabetes and this is how it might affect football, and just say to them sort of, okay, well, how can I support you? So what will make your experience more comfortable and, better to whilst playing football, basically. And I think it's just having that open and honest conversation. I think it's obviously more difficult for match officials because, it's not like you've got a relationship with them. It's not like I guess if you wanted to, you could sort of speak to them before a game. I mean, I definitely don't because I'm just sort of not, I'm just used to it now. But it might be that, parents may have a conversation with the ref saying, oh, my child, has type 1 diabetes, his phone's there on the side, he may need to run over to me, or, the coach speaking to them or something like that. Again, it's just all communication and being open and honest about it, and making it more comfortable for that person.
Yeah, I think especially it does definitely depend on the person, because I think when I was younger, I think maybe because it was a bit less, well, I feel like it was a little bit less known about, but I obviously wouldn't want like my coach to stand in front of the whole team and be like, oh, Louisa's diabetes, like da da da. But I think it's actually be useful for like other people's understanding as well, because especially kids, you won't then get like, I don't know, say like a group of people being like, oh, she always ducks out when it's like sprints or like this sort of thing, because they don't understand. Whereas it's like you'd rather that conversation be like, oh, like, oh, Lou, are you okay? I can see that you've like stepped out. Is it your diet? Like, do you need any help? Kind of thing. It's like changing the conversation maybe, or the mindset, but obviously whilst being aware whether the person would want that as well. So it's kind of like balancing how the kid, especially kids, I think it's probably a bit more sensitive. But yeah, I think just general awareness so that it's not like an exclusion thing or like a thing for someone to be pointed out on. And I guess for my physio always just has like sugar in the med kit. Everyone else does eat it, but it's always like there is always like Haribo's or anything like just available. I mean, the responsibility generally is on us, but obviously there are days where we might have got through all of our sugar and we don't have anything left. Like the amount of times I'm like, well, I had brought 2 orange juices with me and my bloods won't stay up, but then luckily like they've got something else in the med bag as well, so that's always handy.
That's really helpful, thank you.
This is a random question, but obviously in football, your feet take a bit of a battering, and as you know, with sugar problems, you get issues with nails and other things. So, what would you recommend for players, who do have sugar problems and are struggling more with their foot care?
I guess it's just to make sure you're definitely, getting that foot care, getting your feet checked. Obviously, we have to have an annual foot check, but making sure you actually go to those, because it's so important that, you might not see that you've got a blister, or, and like I say, it does take longer for us to heal, for sores and things like that. So just making sure you're getting those checks. If you do feel your boots rubbing, don't just go ahead with it. Take them off, change them. Those sort of things I'd recommend.
Yeah, I don't know whether it's generally like diabetes related or anything like that, but I think football boots generally are quite uncomfortable. So, and obviously I'm aware that looking after my feet is important. So I generally wear some sort of insoles to kind of make my foot supported better and just more comfy. But yeah, if there's ever any blisters or anything like that, definitely like not popping them or anything like that. And also just being aware, try not to like walk around barefooted a lot as well, because one of the things with diabetes is that you can lose like the sensation in the nerves in your feet, so you want to reduce the risk of like accidentally standing on something and not realizing. And also because we take longer to heal, you want to be able to protect. If you get a cut, you don't want to be walking barefoot and then it can get affected quite easily, whereas I'd say for a non-diabetic probably could still, but it's like because the healing process just takes a lot longer. Be careful.
And with the eye problems, and like you were saying, with the potential for bleeding in the eyes, would you then recommend for coaches to kind of decrease chances of headers as well?
I've never actually had that. I don't know. I don't think so. I mean, I feel like I head the ball more than I have it at my feet most matches. So, I don't actually know. I don't actually know the answer to that one. If I'm being completely honest, I don't think it will affect your eyes as such, especially when it comes to retinopathy, because that is just generally to do with diabetes management and how having high blood glucose in having high glucose in your bloods will then sort of create that retinopathy. So I don't think it's anything to do with, I don't think that would affect it. I mean, I wouldn't quote me on it because I'm not 100% sure, but it's not something I've heard before.
Yeah, I'm not sure. I've never really thought about that, to be
No,
honest.
actually. But my eyes are doing okay and I had the ball a lot, so hopefully it is okay. Like to think so.
Um, for women, obviously, different times in the month, your bones and things are more susceptible. Is there with having diabetes, is there a greater risk to those, or do you have to monitor things around like menstruation and other things a bit more carefully?
Yeah, I think obviously it makes an impact on your blood sugars, I find anyway. So sometimes I can be, more sensitive to insulin when I'm on my period. So it could be that I'm having more hypos and things like that. So it's just being aware of those things. I don't think it makes us at higher risk of, those, injuries and things like that, having diabetes. Obviously, we're already at higher risk being a woman, but I don't think they tie in together. However, that time of the month is effective on your sort of blood sugars and things like that, I find. I don't know about you, Louise.
Yeah, I think around my period, I definitely have to change how I'm managing my diabetes. So sort of See, I think I go the opposite, whereas so my blood sugars seem to just run high for the week. I'll be doing lots of insulin that normally would send me to the floor, but actually because of my hormones and everything like that, my blood stay high. So I think again, it's with a lot of things with diabetes, it's actually quite unique to each person. There's sort of general things that happen, but obviously like all our hormone levels are different, or day to day your like your adrenaline or your stress, all these sort of things that you wouldn't even think about, but they actually do have an impact. So even just feeling groggy with being on your period, you probably feel like maybe a little bit worse because your blood sugars are a bit all over the place. But yeah, I'm not sure of any like sort of links between sort of injury or anything like that, but I know generally there is sort of some studies on just periods and injuries and stuff like that. But yeah, I'm not sure about a direct link with diabetes. Just I know that it might just be a bit more difficult to manage during those times.
Fab. Any more questions? I'm just conscious of time.
No, all I can say is I just want to say thank you to you both, because it's quite nice to hear you're really being open about it. Last season we had one player that had type 1 diabetes, and she was like, I don't even want to talk to you about it, I really don't. And I'm one of these mother bear type coaches that really, I really do care about all my players. And she was very much, look, I'm fine. And then it got to the stage halfway through the season, I just went, are you all right? She said, yeah. I said, have you done your check? She had one of those patches on her arms. And she said, yeah. And that's how we left it. That was our understanding, that she didn't want me going, oh, can you do your check? Can you make sure you phone your mum? Can you, that kind of thing. And her mum phoned me a couple of times. She said, could you ask her to do a check? And I said, yeah, no worries. It's not a problem. And, I wouldn't do it in front of everyone else because that's quite a private thing for her. But hearing you both speaking so openly about it, it's quite refreshing, and it sort of refreshed the whole thing for me as a coach to look out for other players. And obviously I mentioned earlier that I've got the younger age groups coming through, and one of them keeps going to the toilet and does drink a lot as well during a 1-hour coaching session. So maybe that's something I can just briefly touch on with the parents and say, look, this is what I've just done, and it could potentially, why don't you just keep an eye on her, kind of thing. But thank you both very much. Really appreciate it. I really wish there was a lot more coaches that could listen to your first-hand experiences, because I think it would help an awful lot of us out here.
Well, like I say, it is, I think if I don't know what age group you coach but or had, I would not have spoken about it either at that sort of younger age, definitely not. And then in my role at Diabetes UK, I'm sort of run a youth project and for 11 to 25-year-olds, and a lot of them don't like talking about diabetes. It's more, just getting together, not talking about diabetes because no one wants to talk about it. So it's completely normal, and the way you approached it was perfect. And like I say, it's exactly how she would have wanted it and things like that. So again, it's just you always know best, don't you, in those situations, and the person you sort of got that relationship with and things like that. So no, thank you for having us, and we'd be more than happy to do it again as well if you have any more sort of uptake at a different time, because I do appreciate, people might be training tonight, and also it's more spare time than, coaches put a lot of time in already, so it's just another hour, isn't it? So we're more than happy to do it again, and it's recorded as well now, so hopefully people might pick it up from that.
And I guess like if there's any like other questions or anything that you think of after, like I suppose Helen, you'll have our contact details if there's anything like specific or anything that you guys wanted to ask post the session. We're more than happy to help. And then I suppose actually if you've got any children within your teams, we'll share the details for the diabetes football community. So right now the biggest sort of part of that is sort of the kids and the parents groups. So I think when we hosted a session in Essex last year, although the kids loved it, I think it was a really good environment for the parents to be in as well, because sometimes they're also not meeting parents of other type 1s. So I think it's like a good good release for them as well. But yeah, we've got we shorten it to TDFC. We've got TDFC like parent groups split by regions, and some people like literally meet up now or like play for similar teams and stuff like that. So if you want the contact details for that to share with anyone that you know, we're more than happy to share that as well.
Yeah, I've just popped the website in the chat for you as well. So have a little look. It's quite interesting. And as well, if you have any kids that want to get involved, then feel free to send the details on.
Yeah, and it's kids, women and men, so it's all age groups. There's something for everyone. So yeah.
Brilliant. Thank you so much both for your time tonight and sharing. I don't think I can sort of round it up better than what Angela shared to summarize. So yeah, just a big thank you to those of you on the call. Thank you so much for joining us tonight. As Louise has sort of alluded to, I'll be in touch later this week with an email just to share all the information with you and some of the links and signposting some key resources that would be helpful. But yeah, thank you again, and have a good rest of the week, and we will speak to you soon.
Thank you.
Thank you.
Bye.
Yeah. Bye.